there, everyone. This is not medical advice. This is just a Canadian giving herself a vitamin B12 shot. I'm not a nurse. I'm not a doctor. I just have to do this once a month, so I'm letting you see. Anyway, this is how I give an IM shot in right here. See how my arm kind of goes like that and then has the bloop? We're going for the bloop. Anyway, so first off, wash your hands, okay? I just washed my hands, I'm perfectly clean. Then, now see, this is the actual B12. This is like less than 15 bucks here, and you just ask for it at the pharmacy counter. It's over the counter in Canada. Anybody can get it. It's not that big a deal. A lot of people are into shaking it like a maniac. I don't, but just because we're here, I'm going to shake it like a maniac just to get some bubbles up so that we can learn how to get rid of them. There we go. And then I open up my nice little scrubby thing and I scrub the arm real good. Blood infection, not your friend. Anyway, then I put this on top of this and I put it back down. Anyway, we're just killing germs. Germs are not your friend. Anyway, then I open up my needle and to take the plastic bit off. Now these ones, because of COVID, I don't get the needles I exactly want. This one is a 3 ml syringe that has 25 gauge, 0.5 millimeter by 16 millimeter. So that means the gauge is way too high, but it just means I can push it in faster. And it's not quite long enough, but you know, I've got big farm girl arms, so it's really forgiving. Anyway, you'll see that this thing is usually on way too tight and it's hard to get off. I loosen it just a little. See, it comes off if you loosen it too much. But if you loosen it a little bit, then guess what? This comes off. Now, you take this, you take off your moist towelette. So you've just got this. You stick this in the rubber bit, turn her upside down, and draw out a bunch. And then you just go down to the 1 mark, because we just want the 1 cc. There we go. Now you'll see that we do have a few little bubbles in there. So just flick them as hard as you can, and they'll come out to the top. And you can see that there's a little bubble right there. We're trying to get that out. So we just push up. Yeah, we waste a little bit, but you know, it's droplets. Anyway, that is bubble free now. Beautiful bubble free. You'll see that the little viewer right here, the tip of the blue part shows that there's red in there. That's the cyanocobalamin. Anyway, then I just take this and I jab her in there. And then, if you keep an eye on the red part at the tip of the needle, I pull out and it goes away. That means it's been a muscle, which is good. Then I just let go and I can just push that in. And then, ta-da, we're done. And that is cyanocobalamin. It is just the gross stuff. It's pink, it's annoying, but it's there. And I usually just give the quick scrub again. Now, the tricky part is getting the cap back on the needle. You don't want to jab yourself because, I mean, who wants to go around with jabbed fingers? Anyway, you use the needle to pick up off the counter this part. Now, we just use that to pick that up. And there we go. No jabbed fingers. Anyway, now we dispose of this safely in a Sharps bin. You can get them at your pharmacy too. Honestly, in Canada, the pharmacy will give you more trouble about getting the needle than getting the serum. And, you know, it's really not as big a deal. Just wait. And my strategy is just to use as few words as possible. Can I please have a 10 ml vial of cyanocobalamin? And they'll say, but you need a prescription for that. And I say, no, it's over the counter in Canada. Can you ask the pharmacist? And they go and they ask the pharmacist and they go, oh, yeah, sure, okay. Just let me get that for you. And then I'm like, but I'm gonna need syringes too. And they're like, oh, what kind? Because they're thinking that you're a heroin addict or something. It's okay. All you have to do is ask for the needles that you want. And they say, well, we don't have them, but we have these, and they're the same thing. Go for it. It's okay. As long as it's, you know, around the same gauge that they use for flu shots or the COVID shot. So there we go. All done. Anyway, have a great day.